The Canadian C-spine rules are a decision-making tool to help determine if a patient requires imaging following trauma. High-risk factors mandating radiography include age over 65, dangerous mechanisms, e.g., high falls, axial head load, high-speed MVC, rollover, ejection, motorized vehicles, bicycle collision, or extremity paresthesias. Low-risk factors that permit safe assessment of cervical spine range of motion include involvement in a simple rear-end motor vehicle collision, being in a sitting position in the emergency department, having been ambulatory at any time, experiencing delayed rather than immediate onset of neck pain, and an absence of midline cervical spine tenderness. The patient should also be able to turn their neck 45 degrees to the left and right. Imaging is indicated if any high-risk factors are present. There are no low-risk factors present, or they cannot rotate their head 45 degrees in both directions.